Hello everyone. As regular viewers and listeners to this podcast will know, we're interested here in encouraging Alexander practitioners to conduct research on their own practice, and we're also keen to connect with people from allied disciplines. So I'm doubly delighted today to welcome Dr Nicola Brough, who is a craniosacral therapist, and through her master's and her doctoral work at Warwick University Medical School has developed and validated a patient recorded outcome measure, or PROM, and she's going to tell us a bit about that, and hopefully that will be of interest to people who would like to conduct research on their own practice. Welcome, Nicola, and thanks very much for joining us today.
Thanks, Charlotte. Thank you for the invitation. It's always nice to talk to a new audience who've not heard about the work before.
What are the sort of typical outcomes that craniosacral therapy clients experience?
Sure.
See how that fits with our Alexander work.
So I guess talking broadly about the evidence base, we see things like pain relief, reduction in stress, improvements in emotional well-being, enhanced whole body health. Cranial work can be helpful for releasing deep-seated patterns within the body, helping to address things like headache, migraines, anxiety, emotional trauma. And there's also lots of positive feedback from those with autistic children regarding the way in which cranial work can assist with emotional regulation and improve behaviours. So that's sort of the broader research evidence base, if you like. But then obviously there's lots of anecdotal information as well.
Yeah, okay, that's very helpful. Thank you. So there are quite a lot of questionnaires out there looking at things like quality of life or sort of well-being, assessing those kind of outcomes, also specific symptoms or allied to particular conditions, psychological or physical. So what was it that prompted you to try and develop? What was another questionnaire? What was the gap that you were hoping to fill through your work?
So for me, I think it's important firstly to define well-being. So well-being is the definition that certainly I've aligned my work to is feeling good and functioning well. And conceptually, there's a difference between symptom and disease-focused measures and a well-being measure. So if we think about the health spectrum, we've got disease on one end and well-being on the other. We can't ask about well-being through symptom and disease-focused lens. So we've got to have a questionnaire that actually speaks to well-being, if that makes sense. So we have to be presenting positive statements, firstly, to be talking about well-being, whereas that's not necessarily the case when you see some of the disease and symptom-specific measures. And we can't make the assumption that because somebody is symptom-free or disease-free, that they're actually feeling good and functioning well. That might not be the case.
True.
So it was about creating a measure that captured those outcomes that weren't being captured by other measures.
Okay, great. And what were the sort of broad conceptual areas, if you like, the broad sort of headings that you were addressing? And how were they arrived at, I suppose?
So I guess that sort of starts me on the journey, really, because I suppose the gap was identified for me because I would see transformation in my clients and I'd think, how do I capture it? How do I measure it? How do I bottle it? How do I evidence it? And there wasn't a tool fit for that purpose. So when I started my Masters by Research, which was originally going to be a study on the effectiveness of cranial work, I needed to identify a measure or a PROM to evaluate the outcomes. And I just had a feeling, I was just like, well, how do we know? Because we know what we hear in practice, but has anybody actually researched this area to explore clients' experiences of craniosacral therapy? And they hadn't. So instead of doing the study of effectiveness, what I did essentially was explored clients' experiences of cranial work, but also looking at what their expectations were of having had CST, and also the effects they attributed to having had CST. So for me, as part of that process, was really getting to understand what clients, felt that were the most important elements for them in cranial work. So I also, as part of that process, did a literature review to look across modalities to see what the outcomes of importance were in other complementary and allied health professionals. And then using all of that data, I created the conceptual framework of CST outcomes. And this really, I don't know if you know what a conceptual framework is, or just for the listeners, it's really like a big mind map of all of the processes and all of the connecting parts of a concept. So for me, I was thinking, okay, out of all of the data that I collated from those 29 interviews that I did with craniosacral clients, I mapped and created the themes out of all of that data, and they covered mental, physical, social, relational, and spiritual well-being. And there was also this aspect of how they changed their perception of coping differently, or how they managed their health differently, or how they perceived an issue. So it wasn't just sort of those domains, but it was really the process in which they relate to those domains as well. And also this recognition that actually symptoms can have different origins, but in terms of recovering, we need energy to recover and to heal. The reduction of symptoms might be that something completes and is resolved altogether, or that actually there might be a reduction of symptoms and then something comes, an amplification again, or that, we're recovering completely. So there was different layers to this, but this was what I was trying to map in the conceptual framework. So ultimately, the questionnaire, which was my PhD, which was really a way of, okay, I've got these ideas now about what I think the outcomes are. I validated that with practitioners and with clients to make sure that it was acceptable, and it was. And then it was like, okay, so is there a measure that can evaluate all of these outcomes? And of course, there wasn't. So it was about creating a measure to evaluate all those outcomes as part of my PhD.
Okay, great, thank you. And what can you give us a flavour of some of the items on the questionnaire, for example, that captures some of those sort of ideas?
Sure. So obviously I've mentioned the 4 main domains, but it also looks at like self-awareness, engaging in life, taking responsibility for oneself, living in the moment, and life satisfaction. And in terms of item levels, so for example, my awareness about my health has helped me manage my life. I've been able to stop and reflect. I'm learning about myself and my body. I felt in control of my health and well-being. I've had too many demands made on me. I've trusted my gut instinct. So these are all sort of statements in which somebody can either connect to or they can't, or to some degree. And it can be really informative about where somebody's locus of control is and how they perceive themselves in within their own life, and sort of within taking responsibility of their own health and well-being.
Yeah.
Does that make sense?
Absolutely, yes. Yes, it does. And I'm sure, many of these ideas will sound familiar to Alexander Technique teachers, the idea of sort of taking control and that kind of thing. Yeah. So within the introduction to this this blog, we've got information about an article that you published in the European Journal of Integrative Medicine.
Yes.
And there it goes through all the fine detail, the more technical detail of the stats, and how your instrument, the PROM, was validated and shown to be reliable and all the rest of it.
Yes.
But it might be helpful just very briefly to say a little bit about what some of its strengths were, how it might be useful, for example, to people who might be listening to this conversation, and maybe where there may be limitations or it might need supplementing, just very briefly. Yeah.
Sure. Well, I think, we've talked again about sort of the difference between disease and symptom focused measures and a wellbeing measure. So this measure can actually sit alongside, like I think you're familiar with the MIMOP, for example. It can sit alongside the MIMOP really nicely. Doesn't have to be either or. Having them both together actually broadens the conversation, because the MIMOP is symptom specific and is about that individual person and why they're coming. But the wellbeing questionnaire opens up that broader conversation beyond the symptoms and the situation, if that makes sense. So they can be complementary. And again, I think it's about the purpose of what you're trying to achieve ultimately. What are your aims and objectives? I think we can use the term research in I guess loosely, but not be applying it in the right way. So I think for me, research is more structured and might be associated with a process that is going through a university or linked to an ethics committee, or setting up a, more sort of rigorous process to do some specific research on a specific area. So let's say migraine, for example. For me, clinical evaluation is the day-to-day practice of using a measure like the WHHQ as part of your daily routine, and doing an evaluation, a service evaluation of your practice, which is within the reach of every practitioner out there, which is a way of everyone taking responsibility to do that, but also you can get a collective group of research in that way quite quickly as well. So I think it's about what the aims and objectives are in terms of how you apply a specific tool.
Yeah, so it's valuable to the individual practitioner researching their own practice, but as a profession also building up sort of case data and sure. Okay, so you validated your questionnaire, you got your doctorate, various prizes, I understand, things like that. What happened next? Where did you take your research next?
So really after the PhD and publication, etc., because I created that in a university environment, there's certain processes behind the scene that you need to go through to get that out into the world, which is very resource draining and time consuming. So a lot of the time and attention post PhD went on actually getting the questionnaire accessible. And then COVID happened. So COVID sobered me to the idea of digitalization. And the world has shifted, hasn't it, somewhat in terms of digitalized healthcare and in all areas of our work and of our life. So I made a decision at that point to never let the questionnaire go out in paper form. And there was multiple reasons for that decision, but the biggest reason being that I guess as a developer of a tool, when you let something go out into the world, people are quite quick to want to change things if they don't like an item or they want to change a word. Well, then you lose the validity straight away. You lose the integrity of the measure. And digitalization in the way that MeasureWell has digitalized is we developed a platform that captures, stores, analyzes and reports on the WHHQ outcomes. So a practitioner doesn't actually have to do any analysis, any data input beyond the name and surname and an email address of their client. So everything is done within this system. So that's sort of what came next, really, which was a couple of years' work, because I needed to pilot the platform to make sure it was accessible to users, etc. So it's been used in a couple of NHS settings, such as oncology, clinical health psychology, some private practices, some community groups. So it's really about getting the field test and the experience of users back. So that's sort of where I'm up to at that point.
And I mean, obviously there's some, I don't mean to use the word pressure, but from the university's perspective, obviously you need to be getting the work out there, but also from your
Mm.
own sort of professional and personal perspective, how important was it, or how did it feel to get your questionnaire out there to be used in the wider world?
I think ultimately, I have to come back to the fact that I'm a practitioner and why, what was my motivation originally? And my motivation was always about evidencing the impact of the great work that I was doing, but also that my profession was doing. So for me, the reason to want to get the WHHQ out in the world is it has many strands to it, but in terms of cranial work, it's about that wider acceptance of cranial work as a valid treatment, increasing the public profile of CST, improving the credibility of our profession, and the potential for it to enhance funding applications if you've used the measure to demonstrate that you're using a systematic and rigorous process, so that you're really evidencing, the work that you're doing. So they were on that larger level as a profession, that's the reason that's what motivates me. And I've had this vision, to have clinical evaluation more embedded in the training of CST. And actually yesterday, this is again something that's been in my vision for 15 years or so. I had the opportunity to present to some second year students who are going to incorporate it as part of their case studies. So for me, there's so many strands to this. Because ultimately it's about evidencing the great work that we do. And that's not just in CST. I'm talking about, the multiple modalities out there that improve the lives of so many people. And yet the narrative has been that there's been no evidence base. And so I don't know. I don't think we need to align ourselves with that narrative anymore.
No.
Because the world's a different place. We can all take responsibility and gather data, clinical, evaluate or practice daily, and use that information in a different way. So, and I guess coming back just for clients who come, into practice, it's about helping them to share concerns that are important to them. It improves communication between you and your client. It can prompt discussion, and it helps your client monitor the changes and the effects of the session as well. So, it's everybody, I think everybody wins using, a process like this.
Yeah.
Yeah.
Okay, that's great. And so I think many of our viewers or listeners will have heard of, know a bit about craniosacral therapy, but for those that don't, I wonder if you could very briefly just tell us a little bit about it.
Sure. I mean, that's the big question, isn't it? What is it? So I think for me, and this is me speaking personally, as humans, we're energetic beings, and craniosacral therapy is a way of working and coming into relationship with another that honors their innate wisdom and the innate intelligence of that person and the individual to know how to recalibrate themselves. So it's the inclusivity of the mind, body, and soul, the intelligent and the multiple facets and the dynamic processes that are expressed moment by moment with an individual. So for me, craniosacral therapy is more about a way of being. And I know there's so much great research being done now on the human body and the energetics of the human being and the fields that we are. And we know that these fields and these energies can be influenced by thoughts, events, viruses, the food that we eat, the experiences that we have, the internal, external environments. And essentially, it's how we live, isn't it? And anything that happens to us is a potential for diminishing that function. So I think for craniosacral therapy, most will perhaps understand it as a hands-on method that helps to enable the structure and the systems of the body to function optimally. And that's done in different ways of coming into contact with different parts of the anatomy. And I was reflecting on this question to think about my teacher, Franklin Sills, and he said that craniosacral therapy was mostly perceptual in nature. What I understood that he meant by this was about the way in which we organize and identify and interpret sensory information, how we perceive it. And he also said that listening was the heart of clinical practice. And I think I would like to add that I think the heart is actually the center of listening. So for me, when I'm practicing, I really come into my heart and I sit with this other individual. And from a neutral, open-hearted space, it's okay, what's possible for us here between us to create? And I think for me, it's the physiological and the psychological processes that can arise out of that awareness of being in the now and the presence, and that intelligence that can bring through, that can shift things and assist the client moving forward. So I'm not sure if that is succinct enough, but that's my experience of I guess, being a craniosacral therapist and the processes that arise in that exchange with another and with a client.
Yeah, okay. I think Alexander practitioners also struggle with trying to put something holistic into a nutshell. It's not easy to do, is it, really?
No.
Okay. Moving forward, do you have any thoughts about where Measure Well and the questionnaire are going in future?
Yeah, so at the moment, the Craniosacral Therapy Association are using or have provided access for their members. So any member that wants to access the questionnaire can through their membership. And that means that we're doing a collaborative piece of clinical evaluation. And so later this year, I'm hoping to report on that. And we've seen some really positive results through different people's practices throughout the country, which is really exciting to see that bigger picture work happening. And like I said, that embedding clinical evaluation into training, so that's just starting to happen as well. And so in terms of the cranial profession, that's great, but if I broaden out and go, okay, the wellness sector is huge, we all need to be evaluating to demonstrate the great impact that we're doing for others, in service of others. And ultimately, at the end of the day, we're all trying to make a living as well. So if you can demonstrate how you have positive outcomes for the people that come through your doors, and you can promote yourself using that information because it's factual, then that's got to be, again, I think, a bonus for any practitioner out there. So yeah, that's the bigger vision for me, is just anybody can use the measure. So it's digital and it's available. So it's great.
All right. Well, that's absolutely brilliant. Thanks very much for your time, Nicola. I'm sure that will be music to our ears, everybody's ears. It's lovely to hear you talk in this way. Thank you very much.
Thank you.